Welcome back. Today we're gonna explain tricuspid atresia in a very simple way. So keep it up with me. Atresia, it means there's something is underdeveloped. It's not developed yet. And whose it's not developed? The tricuspid valve. So the tricuspid valve, it's just a block. There will be no outlet from the right atrium to the right ventricular. There will be no outlet from the right atrium to the right ventricular. Because we have block, the right ventricular will become less functional. It's a general rule. It's also a rule we use it in our life. If you don't use it, you will lose it. And this is applied in the right ventricular. But how this patient will live? Let's imagine with me. So, here is the blood deoxygenated. Here we have deoxygenated blood. When we have atrial septal defect, here between the two atrium, it will promote the blood to move from the right atrium to the left atrium. And from here it will go to the left ventricular, and from here it will pump to the body. But how it will get oxygenated? We should have a ventricular septal defect. Ventricular septal defect, it's promote the pulmonary blood flow, and this is how the baby lives, just like less than years. So we have to do a surgical correction. So we have a ventricular septal defect here, and here's the baby, and here's the blood, will move from the left ventricular to the right ventricular, and it will go to the pulmonary blood flow where it will get oxygenated. And from here it will go to the left atrium, to the left ventricular, and pump to the blood. So we should have the atrial septal defect and ventricular septal defect to promote the pulmonary blood flow. Because there is a lot of pressure in the left ventricular, the left ventricular will become hyperatrophy. And because of that, there will be something we call electrical shift. So the overall electrical will shift more toward the left because the hyperatrophy. So this is something special to the tricuspid atresia. In ECG, we will see left axis deviation. So if you see on ECG left axis deviation, it's a characteristic for tricuspid atresia. Okay, so an ECG will be a left axis deviation plus left ventricular hyperatrophy. And in neonatal, this is something it's not a normal thing, because there is electrical forces shift to the left. Okay, in a normal chest X-ray, we will see a fine line that represent a blood vessel. But because in this disease there is less blood go to the pulmonary, the fine line will decrease. Why? Because there is no enough blood that go to the pulmonary, so it will decrease. So in chest X-ray, we will see pulmonary under circulation. Why? Because there is less blood going to the pulmonary. So it is the reason for decreased pulmonary marking in chest X-ray. What is the pulmonary marking? It's a visible blood vessel in a lung appear as fine line in normal things. Also, as a diagnostic, we will use echocardiogram as a gold standard. But how the patient will present? It will present severe cyanosis at birth. How do we treat it? Of course, we need a surgical correction, but until the surgical correction happen, we give them BGE, prostaglandin E, to keep the ductus arteriosus open until the surgical preferred. What is the surgical things we do? Aorta pulmonary shunt. This is the name of surgical correction. And we can also use an atrial balloon to enlarge the opening of atrial septal defect, to enlarge the opening here. So this is the treatment. Corrective surgery can be preferred. In the absence of surgical intervention, most of children die in the first year of life. But with surgical reappear, it improves 10-year survival to 18%. That is the Tricuspid Atresia. Give me a like and subscribe. Thank you for watching, and this is Heart for You.